Parvati Shallow here with world-renowned doctor, addiction specialist, talk show host, and radio show host, Dr. Drew. What do you think needs to change in our conversation about addiction and recovery as a nation?
We still have to let go of this moralizing model about substances. I mean, there's no such thing as a good substance and a bad substance. It's not like alcohol is good and cannabis is bad. Alcohol is bad. Alcohol causes cancer. Alcohol causes more disability and problems in this country. Tobacco even worse than alcohol. You want to look at a bad drug. Our legal drugs are the bad ones. OxyContin causes horrible addiction. But if you have pancreatic cancer or a broken leg, it's a good drug. So it's the context and it's the relationship that humans have with chemicals that really it's at issue here. It's not a good thing or a bad thing. It's not a weak or a strength. It's just it's a biological relationship that humans have in certain context. And we have to just think about it, non-judgmentally, non-moralistically is the important thing.
What's it going to take?
It's going to take changing the laws. It's going to change the practice of medicine. It's going to change the culture's understanding of pain and what we can do with that, and childhood trauma and how childhood trauma should be treated. I mean, most of these people that are oral opiate addicts are childhood trauma survivors, and that has a treatment, and the treatment is by skilled professionals. 90% of the oral opiates in the world are consumed in America. There's enough Vicodin out now to give every single person in this country a pill every 4 hours. I think it's for a month. That's just prescribed at this moment. Forget over the year. That's just what's out there. It's insane. It's totally nuts. And I'm concerned about it. It's the disease of our time, and people aren't really understanding what it is.
And do people need to have that motivation to stay sober in order to get sober?
Oh yeah, you've got to, because the disease fundamentally is a motivation disturbance. It's a broken motivational priority. The system that sets the survival, all these wonderful systems in our brain are driven or motivated by a survival system, right? Basically, which has hunger and thirst and sexual drive and those sorts of things. Well, all that shrinks and this one priority emerges: use. It's not a conscious thought, it's a motivational drive. And it colors thinking, feeling, everything else, how you relate to people, and it's always there now. That's the disease. I'm Dr. Drew, and I say it's time we stop treating addiction as a weakness or a moral problem.